I'm Dr. Cole.
And I'm Dr. Phil.
And welcome to our YouTube channel. So today we're going to be talking about Bell's palsy. Bell's palsy causes sudden and temporary weakness in your facial muscles. This makes half your face appear to droop. Your smile is one-sided and your eye on that side resists closing. Bell's palsy, also known as facial palsy, can occur at any age. The exact cause is unknown. It's believed to be a result of swelling and inflammation of the nerve that controls the muscles in the side of your face. Or it might be a reaction that occurs after a viral infection. For most people, Bell's palsy is temporary. Symptoms usually start to improve within a few weeks. With complete recovery in about 6 months, a small number of people continue to have some Bell's palsy symptoms for life. Rarely, Bell's palsy can reoccur.
So, Cole, tell me some of the symptoms of Bell's palsy.
Well, I'm glad you asked, Phil. Signs and symptoms of Bell's palsy come on sudden and may include rapid onset of mild weakness to total paralysis on one side of your face, occurring within hours to days. Facial droop and difficulty making facial expressions, such as closing your eye or smiling. Drooling, pain around the jaw or in or behind your ear on the affected side. Increased sensitivity to sound on the affected sides. Headaches, decrease in your ability to taste, and changes in the amount of tears and saliva you produce.
What are some causes of Bell's palsy?
Well, some causes, although the exact reason Bell's palsy occurs isn't clear. It's often related to the exposure to a viral infection. Viruses that have been linked to Bell's palsy include the viruses that cause cold sores and genital herpes, chickenpox and shingles, infectious mononucleosis, cytomegalovirus infections, respiratory illness, German measles, mumps, flu, and hand, foot, and mouth disease.
So, what are the risk factors that come with this disease?
Well, Bell's palsy occurs more often in people who are pregnant, especially during the 3rd trimester, or who are in their first week after giving birth. Have an upper respiratory infection such as the flu or cold, and have diabetes. Recurrent attacks of Bell's palsy are rare, but in some of these cases, there's a family history of recurring attacks, suggesting a possible genetic predisposition to Bell's palsy.
Are there any complications that come with it?
Well, there are a lot of complications, Dr. Phil.
Oh.
Mild cause of Bell's palsy normally disappears within a month. Recovery from a more severe case involving total paralysis varies. Complications may include irreversible damage to your facial nerve, abnormal regrowth of nerve fibers, resulting in involuntary contraction of certain muscles when you're trying to move others. For example, when you smile, the eye on the affected side may close. Partial or complete blindness, and your eyes won't close due to excessive dryness and scratching of the clear protective covering of the eye.
Very good.
And that's all for today, folks. See you next week. Let's go. Close it.
Thank
How
you.
long was that?
Hey, you started off a little.